This meeting is now being recorded.
Hello, and welcome to your open enrollment presentation for the 2019-2020 period. My name is Tiffany Hill, and I work with Brown & Brown Insurance, and we are your employee benefits broker. So today's presentation is to provide you with a high-level overview of each one of the plans that are provided to you as part of your employee benefits program. Do keep in mind that if you do decide to make any changes during this open enrollment period, they will go into effect December 1st of 2019 and go through November 30th of 2020. Your open enrollment period has begun. It started on October 28th and will go through November 8th. So please do make sure to get all of your changes submitted no later than November 8th. This presentation is for in-state exempt employees. So I will be using your Benefits at a Glance booklet that you can see on the screen. And if you have it in front of you, you can certainly follow along. Page 2 in your Benefits at a Glance booklet does talk about some general information, some terms that we use when we're discussing insurance plans. But I will be sure to discuss those in more detail so that it makes more sense as we discuss the plan. So I mentioned that this is your open enrollment period, which does mean that you are eligible to make any changes that you wish to do so for the effective date of December 1st of 2019. And really, this is your only time throughout the entire year that you can make changes to your plan, unless you experience something called a qualifying life event. So a qualifying life event would be situations such as getting married, getting divorced, having a change in your employment status, having a baby or adopting a baby. Any of these situations would allow you to make changes to your benefits outside of the normal open enrollment period, but you must be sure to report your qualifying life event within 30 days of the date of it occurring in order to be able to make those changes to your plan. So do keep that in mind if you are going to be experiencing one of those situations. At the bottom of page number 3, I did want to call to your attention an email box that we have set up here at Brown & Brown for any open enrollment questions that you might have after viewing this presentation. I know this is a lot of information to take in, so if after you listen to this presentation, you think of any questions that you might have, please don't hesitate to reach out to us at roigquestions@bbdaytona.com, and we'll be sure to respond to you with an answer as soon as possible. So page number 4 has some information on the Florida Blue member portal, which is called My Blue Service. If you are already enrolled in one of the Florida Blue plans and you have not yet registered for My Blue Service, I would certainly suggest taking a few minutes to do so. My Blue Service allows you to have a personalized view into your health insurance plan where you can check the status of any claims. You can look at your plan's details. You can request a replacement identification card. And you can also look for doctors or hospitals as well, too. So if you haven't already registered on My Blue Service, make sure to do that. A lot of the things that you can do on My Blue Service, you can also do on the app. So that's the Florida Blue mobile app. If you are somebody that does not want to carry your ID card with you, you can access and see the image of your ID card on the app and do most of the same exact things you can do on the portal. So definitely take advantage of downloading the app. The other couple things I wanted to mention, Blue 365 is the discount program for Florida Blue members. And what that is a health and wellness discount program where you can enjoy discounts on things like vision care, hearing care, and hearing devices. There's also some great travel discounts. And then a very popular one is the fitness center discount program through a company called Tivity Health. So instead of you having a gym membership to one gym, you can actually pay $29 a month through Tivity Health and have access to a nationwide network of gyms. So again, just take a few minutes to register on www.blue365deals.com and you can enjoy all those discounts. Lastly, if you're somebody that's looking for some healthy resources as a Florida Blue member, there's a lot of great tools and resources there that you have access to, such as health coaches and a lot of great web-based information. So again, worth it to register and see what's all out there on the website for you. So now let's take a look at your medical insurance coverage options. You have 3 Florida Blue plans to choose from. The first 2 are going to be Blue Care plans, which means that you would have to choose a primary care doctor. And these are HMO plans, so you'd want to make sure that you're staying within the Blue Care network. And then your third option is the Blue Options 05786 option, and this is going to be your only PPO option. So do keep that in mind if you're thinking of changing plans. The first two plans that we will review are going to be HMO plans, and then the last one is going to be the PPO plan. So I'm going to go ahead and start with the Blue Care HSA plan. The reason why this is called the HSA plan is because it's the only plan that is compatible with what's called a health savings account. And a health savings account is an opportunity for you to put aside pre-tax dollars into an account that you can use for any qualified medical, dental, or vision expenses. A lot of people find that this is very helpful because they can save for some out-of-pocket expenses that tend to be a little bit higher on this plan, just simply because all of your services and prescriptions are subject to the deductible. And until you've met that deductible, sometimes those expenses can be higher than normal. And they also like the fact that that's a tax-advantaged account. So basically, you're lowering your taxable income if you are putting in any kind of contributions into the bank account. I'll discuss the HSA in more detail after we've reviewed these three plans. So in looking at this first plan as well as the other two, the first thing I noticed is that adult and child wellness exams are covered at 100%. And so what that means is you can visit your doctor for a routine physical, routine blood work, well woman exams. Those are all considered wellness exams that are covered at 100% on each plan. So regardless of which plan you choose, you do have access to that being 100% covered. The second thing I noticed about this plan is that all services as well as prescriptions are subject to the deductible plus coinsurance. So how this plan works, if you're new to the plan and you have not yet met your deductible of either $1,500 or $3,000, then you would be responsible for paying the full cost, or what we call the contracted rate, up to the deductible. So if your doctor's visit is $100, you're going to pay that $100, and that's going to track towards your deductible. So for individual, that number is $1,500, and then if you have any dependents on your plan with you, that number is going to be $3,000. So even if it's just you and your spouse, it is going to be a deductible of $3,000. So all of your doctor's visits, your hospital services, your diagnostic services, as well as your prescription drugs, you'll be paying the full contracted rate until you reach your deductible. Now, once you've met your deductible on this plan, you'll then move into what's called coinsurance, and that amount on this plan is 20%. So you would be responsible for paying 20% of anything after the deductible is met, and the other 80% is covered by the plan. Another thing that occurs once you've met your deductible is that your prescription drugs will now move to a copay. So remember, copay is just a flat dollar amount that you're going to pay each time you have that prescription filled. So that's going to be either $10, $50, or $80. The third thing that happens on this plan, if you're continuing to utilize it, is you would meet your annual out-of-pocket maximum. Keep in mind your annual out-of-pocket maximum is a total accumulation of all dollars spent on the plan. So that number for employee-only coverage is $4,500. And then if you have dependents on your plan, it's going to be $6,850 per person. And if there are multiple people on the plan that collectively meet $9,000, then that would be the end for the family. In the event that you do hit your annual out-of-pocket maximum, do keep in mind that for the remainder of the calendar year, all other covered medical services would be paid for by the plan. So that's the catastrophic kind of worst case scenario number. We don't typically want you to meet that number, but it is there to protect you in the event that you have a very high medical expense situation. At the very bottom, you'll notice there are no non-network benefits for this plan as well as the next plan that we're going to go over. So do make sure that you are going to only in-network providers. So for this plan, as well as the Blue Care 47, which is the next plan we're going to review, you do have to make sure that you are electing a primary care provider. And instructions on how you can do that are listed there at the bottom of page number 5. So you're going to visit floridablue.com, find a doctor, you're going to select the Blue Care network, and then put your zip code in to be sure that you can find your provider's ID number and NPI number. So the second plan option is going to be the Blue Care 47 plan. This plan is also an HMO, but the big difference, first and foremost, is you do have copays on most of your commonly used services. So your doctor's visits will all be copays. Your emergency room and urgent care will be copays, as well as all of your diagnostic services and prescriptions. So this plan has a similar employee-only deductible of $1,500, but the family deductible on this is $4,500. There are only a couple things that are subject to the deductible in this plan. That's going to be your inpatient and outpatient, as well as some other services that are not listed here but can be found on the carrier benefit summary. So keep in mind the majority of times that you're going to be using your plan, you will pay a copay. For example, you go to your doctor, it's going to be a $30 copay, and then specialist and chiropractic care is going to be a $55 copay. Your urgent care copay is $60, and then your emergency room copay is going to be $250. You can see you have diagnostic service copays for all of that. And then at the bottom, you'll notice your prescription drug copays mirror exactly what the first plan was, but you do not have to meet your deductible. So from day one, it's either going to be $10, $50, or $80 for your prescription. So keep in mind, while it's nice to have copays, this plan is not compatible with the HSA that I talked about, so you would not be able to put any money aside into the health savings account with this plan. You could only do that with the first plan. Now your third plan option is going to be the Blue Options 05786. And as I mentioned at the beginning, this is the only plan that does have out-of-network coverage, so you do not need to pick a primary care doctor with this plan. Similar to the first two plans, you do have 100% coverage of your adult and child wellness exams. And pretty much all services and prescriptions do have a copay associated with it. So what that means is you have a deductible of $1,000, but most of the things you're going to use this plan for, you really don't have to worry about that deductible. You're just going to pay whatever the copay amount is. So copays on your doctor's visits, copays on your emergency room and urgent care, and then of course, you can see your inpatient and outpatient are both copays as well. So for inpatient, if you're visiting an option 2 facility, it's going to be a little bit more. Those are training hospitals. So for option 1, that's going to be most of your hospitals that are located around you. It's a $500 per day cost, but you would pay no more than $1,500 max for your hospital stay. So this plan is very similar to the second plan. I would just do a side-by-side comparison just to see the differences. I'm noticing that the doctor's visits are a little bit less in terms of your copay. Your urgent care copay is a little bit less. But what is really making this plan stand out more than the other two is the fact that there is out-of-network coverage, and your deductible and out-of-pocket max is slightly lower on this plan as well too. So in making a decision, it would be wise to look and see if having out-of-network coverage is something that you're really looking for. Otherwise, you have 2 in-network only plans to choose from. There are certain situations when people have certain critical illnesses or chronic conditions where they do need to see out-of-network providers. So this is a great plan option for somebody like that that's looking to ensure they can go to any doctor that they need to. So now that we've discussed the 3 medical plan options, I'm going to move on to page number 6, which discusses the health savings account. And this is provided by Optum Bank. So this is truly a bank account that you are going to put your pre-tax dollars into to pay for medical, dental, or vision expenses. So if you were already enrolled in the HSA plan last year, one thing I wanted to mention is the maximum annual contribution limits, which are determined by the IRS, are increasing for the year 2020. They're going up by $50 for individual coverage, so it's $3,550. And then if you have dependents on your plan, it's going to be $7,100 with an increase of $100. You still do have that catch-up contribution amount for people age 55 and older. Do keep in mind that not only does the IRS determine what the max contribution limits are, they also determine what we can use this money for. So we have listed some examples there on page number 6, but if you're looking for a full inclusive list of all qualified medical expenses, please see IRS Publication 502 for that list. So just a quick review of what the HSA is. I mentioned it's a bank account, and you would swipe your card to use it, just like you would swipe your regular bank card. Keep in mind that this is an account that's in your name. You own the account, so even if you decide to change jobs or you retire from your position, you will continue to have that account, and the money does not go anywhere. What's really nice about the account is if you have a great year where you don't really spend the money in the account, the money simply rolls over to the next year. So you do have to be covered by the high deductible health plan, which is the first plan we discussed. You can't be covered by any other health coverage that's not a high deductible health plan, nor can you be enrolled in Medicare or be claimed as a dependent on somebody else's tax return. So keep in mind there's some great tax advantages to this. And then, of course, like I mentioned, it's good to have some built-up savings in the health savings account to help pay for some of those out-of-pocket expenses that are associated with using your health plan. Do keep in mind you can also use the money for dental and vision expenses. So moving on to your dental insurance coverage through Guardian. So the first plan is a DHMO, which is very similar in terms of how the plan functions to your medical HMO plan, because you do have to make sure that you choose a primary care dentist, and you do have to make sure that you're staying in network with regards to receiving care. Your other option is the PPO plan, and this plan does allow you to go out of network if you choose to do so. So the first thing about the DHMO that I wanted to point out is there is no annual max benefit. So what that means is there is no maximum amount that the plan is going to pay on your behalf for your dental services. The other thing that's nice about this plan is you do have copays associated with your procedures and treatments that you receive, so you know in advance exactly how much you're going to be paid for that type of service. As you can see, preventive procedures, most of them are covered at no charge. Now, once you get into basic and major procedures, there are copays associated with each one of those dental codes, which then, of course, is associated with whatever the service is that you're receiving. The other thing that's worth mentioning on the DHMO is if you do have a child or you yourself are looking to receive orthodontia procedures, this plan is the only option that would provide coverage for that. So if you're thinking of possibly having those types of services done with orthodontia, I would certainly suggest looking at the DHMO. So please do keep in mind if you're new to the DHMO, you do have to designate a primary care dentist, and you can do that by visiting guardiananytime.com, and find a provider and then make sure that you're choosing the managed dental care plan type. At that point, then you'll just enter the zip code and filter it by primary care dentist, and then you'll be able to look at the primary care dentist ID numbers. If you do not pick a DHMO primary care dentist, then one will be chosen for you, and you can always change it later on. So looking at the PPO plan, again, I mentioned that the DHMO does not have an annual max benefit, but this PPO plan does have one, and that number is $1,500 per person. So what that number represents is kind of like your bucket that you can spend on your dental services throughout the year, and that is per person. So if you have any children or a spouse on the plan, each person will receive $1,500, which is what is going to be used to pay for your dental services. There's also a deductible in this plan, a calendar year deductible of $50 for individual and $150 for family. That deductible is waived for preventive procedures, so that's going to include things like your exams, your cleanings, and your x-rays, and the plan is going to pay 100% of those charges. Basic procedures, which are going to be fillings, surgeries, and anything periodontal related, you would first pay your $50 deductible, and then you'd be responsible for 20% of the total cost. The other 80% is going to be covered by the plan. And then major procedures, crowns, bridges, dentures, and implants, those would be paid for at 50%, and you would pay the other 50%. On the very bottom of the PPO, you'll notice there is a maximum rollover program. This is only on the PPO. It is not included on the DHMO. So if you've already been on the PPO, you might already be accumulating some of this rollover amount. How it works is if you do not spend more than $700, which is the rollover threshold, in a calendar year, you have the ability to roll over an additional $500 for the next year. If you're going out of network, then you will roll over up to $350, and the most you can have in your rollover account is $1,250. If you do not know how much you have in your rollover account and you are interested in finding out, you can either call Guardian at the number listed on the back of your card or on this page number 7 in your benefits at a glance, or you can also register on guardiananytime.com and find out what your rollover account has in it. So obviously the more you have in your rollover account, the more you can tack onto your $1,500, which is your dental max, and then of course that's going to help pay for more expensive types of procedures. Moving on to your vision insurance coverage, which is through iMed. So this plan is going to cover your eye exams every 12 months at a $10 copay. It's also going to cover your basic lenses every 12 months at a $25 copay. Your frames are going to be covered every 24 months, and the plan is going to give you $130 to spend with a 20% off discount on the balance. Now, if you just wear contacts, you can have your contacts replaced every 12 months, and you're going to be provided a $130 allowance for those. If you wear both eyeglasses and contacts, you cannot have both of them covered by the plan in the same year. So you have to make the decision to have either glasses covered during that year or contacts covered during that year. You can use this plan out of network if you choose to do so. It is more of a reimbursement style plan where you'd pay out of pocket and then fill out a claim form and be reimbursed up to a certain dollar amount. If you are looking for providers, you're going to visit imedvision.com and you're going to make sure to choose the Insight Network. A couple other discount programs that are listed there at the bottom. You can notice that by going to Sears Optical or Target Optical, you can get any frame, any price for $0 out of pocket. And then if you wear contacts, ordering your contacts from Contacts Direct is going to give you an additional $20 allowance to tack on to your allowance of $130. So you can make the most out of your allowance there. Moving on to your short-term disability and your long-term disability plans, these are both through Guardian. So short-term disability and long-term disability are what we like to call paycheck protection because they do protect a piece of your income if you're ever ill or have an accident where you're no longer able to work. So starting with the short-term disability, this is a voluntary plan, which means if you're interested in having it, then you would pay your premium out of your paycheck. So how this plan works is after being out because of an illness or an accident for 7 days, your benefit is going to begin on the 8th day. After that starts, you're going to be receiving 60% of your basic weekly earnings up to a max weekly benefit of $2,500. And you can actually receive this disability benefit for up to 12 weeks, which is why they call it short-term disability. So there is a pre-existing condition exclusion on the plan. This would only apply to new people on the plan. So if you've already had the plan for 12 months, you can disregard this piece. But for anyone new, just do keep in mind that any claims put in within the first 12 months of the effective date of coverage, which would be December 1st, any claims would be looked at, and Guardian is going to look back 3 months prior to the effective date to see if you were treated for, diagnosed with, took any prescriptions for, anything regarding that claim. And if the answer is yes, it would be considered pre-existing and the benefit would not be paid out. That's only within the first 12 months of the effective date of coverage. So again, if you've already been on the plan, you can disregard that piece of the policy. So the rates are on the following page, and I'll show you what the calculator looks like. But moving on to long-term disability. So long-term disability is a company-paid benefit. So your employer does pay 100% of the cost for the long-term disability, but I do want to make sure that you understand how the plan works. So if you're already enrolled in the short-term disability, remember you've been being paid for 12 weeks of benefit time. And if you still are not back to work after those 12 weeks, then the long-term disability is going to kick in directly after that. If you choose not to be enrolled in the short-term disability, then there is a 90-day waiting period for the long-term disability, but it functions very similarly to the short-term disability. The big difference is instead of getting a benefit paid out to you every week, on the long term, you're getting a benefit paid out every month. So the benefit would equal 60% of your basic monthly earnings up to a max amount of $10,000 per month. And this benefit could be paid out for 2 years if you're disabled in your own occupation. And then if you're disabled in any occupation, the benefits could potentially be paid out to your normal Social Security retirement age. Again, very similar to the pre-existing condition exclusion on the short-term disability, the long-term disability also does have that same exclusion. So any claims in the first 12 months of the effective date of coverage, there would be a 3-month look-back period just to ensure that this was not a pre-existing condition. Again, if you've already been on the plan for 12 months, you do not need to worry about the pre-existing condition exclusion. This would only be for new people on the plan effective December 1st. So this is what your short-term disability benefit and premium calculation worksheet looks like. Again, if you're interested in purchasing the short-term disability and you've already declined it in the past, you can certainly choose to enroll this year, but you will need to make sure that you fill out what's called an evidence of insurability form, which is basically just a medical questionnaire asking you some questions about your medical history. This is only for people who have declined this benefit before in the past. So make sure you get that form filled out and sent into Guardian, and then they make the decision as to whether you'll be enrolled or not. So if you're just looking to see what this would cost, here's some basic math on this calculation worksheet. Again, if you do need assistance with figuring out what the cost would look like, please don't hesitate to shoot us an email and we'll make sure to get you what the premium would look like. So moving on to your life and accidental death and dismemberment insurance coverage, again, this is through Guardian. So your basic life insurance is employer paid, and your employer is providing basic life insurance in the amount of 1 times your salary up to a max amount of $300,000 completely at no cost to you. So because this is your open enrollment period, it's a great opportunity for me to remind everybody to make sure to have your beneficiary listed if you do not currently have one listed, and also make sure that this is the person that you wish to be listed as your beneficiary. So that's your basic life insurance. And then your voluntary life insurance is below there on page number 11. Voluntary is indicating that you get to choose the amount and then you would pay for whatever the amount is out of your paycheck. So you can choose to purchase the voluntary life insurance in increments of $10,000 all the way up to a max benefit amount of $300,000. Very similar to the short-term disability in that if you have ever declined the voluntary life insurance in previous years, and this year you decide that you'd like to purchase some additional life insurance, you can certainly choose to apply, but you will have to fill out an evidence of insurability form, just basically answering those medical questions, and then Guardian would make the decision as to whether you will have the coverage or not. If you'd like to purchase spouse coverage, you could do that in $5,000 increments, but it cannot exceed 50% of whatever you elect on yourself. And then for child coverage, it's age 14 days to 26 years, and it's a flat $10,000 amount. So you might be wondering what the costs are for the voluntary life insurance. They are age banded, so you do stay in the same age bracket until you have a birthday that moves you into the next age bracket, and then of course that change would be determined in your per paycheck cost. The child life insurance is $1.88 per month, and that amount is regardless of whether you have one child or multiple children. So if you choose to buy the child life insurance and you have 2 children, you pay $188, and both children would receive a $10,000 policy amount. In the bottom right-hand corner, you'll see that blue box that does help you figure out what your voluntary life cost would look like per paycheck. Again, any assistance needed, please don't hesitate to reach out to us. So the last couple benefits are things that are associated with certain Guardian plans. So this is what we call the College Tuition Benefits Rewards Program. This is on page 13 in your Benefits at a Glance booklet. If you're currently enrolled in the dental PPO option through Guardian, you are already enrolled in this program. But one thing you do have to make sure you do is register to be able to utilize this benefit, and that's going to be at guardian.collegetuitionbenefit.com. So what this program allows you to do is earn what we call tuition rewards. Each year you are accumulating 2,000 tuition rewards. And keep in mind, 1 reward equals $1 in tuition reduction. You can use this tuition reduction for your children, grandchildren, nieces, nephews, or godchildren. So when you go to register on the site, it is going to ask who you would like to designate these points to, which again, 1 reward equals $1 in tuition reduction. And that tuition reduction, of course, if your dependent, whether that's your child, your grandchild, niece, nephew, or godchildren, decides to enroll at one of the over 380 private colleges and universities that are currently participating, then of course they can have a tuition reduction just by using your tuition rewards that you've earned by having the dental PPO. If they choose not to go into any of the schools on the list, then of course there's no loss there because there's no extra charge to being part of this program. You're automatically a part of this program just by being enrolled in the dental PPO plan, but we do want to make sure that you are designating those tuition rewards no later than the dependent senior year in high school. So please do make sure that you make use of this. It doesn't cost you anything more, and it's something that's already included in your dental PPO plan. The last thing I wanted to mention is your employee assistance program. So this is a confidential program. Again, no extra charge for you to actually utilize this benefit. And what this benefit allows you to do is have access to unlimited free telephonic consultations with EAP counselors, and you can use this 24/7. If you need to be referred to local counselors, you can have up to 3 free face-to-face sessions. So keep that in mind that you have access to face-to-face sessions as well as your telephonic consultation. So keep in mind the Work Life Matters program is not just good for things like grief or depression or issues with drugs and alcohol, but you can also use it for things like legal and financial planning. Maybe you have some questions on dependent care and caregiving in general, or maybe you're just looking to speak to somebody about career development. There are so many things that you can use your Work Life Matters benefit for. And again, there is no reporting that goes back to your employer. It's completely confidential. So certainly make use of it if you need to. The rest of your booklets are some important notices that are placed there for compliance purposes. You do have a lot of information listed there, and on the very last page, you have information on the CHIP model and all of the state Medicaid information. So if you're interested in looking at that, all of that information is located in your Benefits at a Glance booklet. So that concludes your presentation for the 2019-2020 open enrollment. Again, if you think of anything else that you need to ask questions on with regards to anything that we've talked about today, please don't hesitate to send an email to roigquestions@bbdaytona.com. Just as a quick reminder to have all of your changes, if you are deciding to make any changes to your plans, submitted no later than November 8th of 2019. I hope that this presentation has been helpful for you, and I hope you have a great rest of your day. Thank you.